Hi everyone, welcome to my YouTube channel. Today we'll be talking about positioning terminologies. We're going to be looking at various terminologies we use in imaging technique as well as in the practical aspect, positioning your patient for every examination. The first thing we'll be looking at is erect. When you talk about your patient is erect, that is, the patient is standing upright. And this time around, I want you to understand that it is both standing and sitting upright. That's what we term as erect, with their body in a vertical position. We move on to supine. For supine, your patient is lying on the back, lying on the back with their head facing upward. That's what you mean by supine. And you can see it from the picture here. This is your x-ray couch. A patient is lying on it, facing upward, facing the tube as well. So that's what is supine. Now, for your prone, your patient is lying down as well, but this time around, they are facing a different direction. Your patient is facing downward this time and lying horizontally as well. You can see it from this picture too. Then there is something we call AP, and it is termed anteroposterior. That is, your beam is passing through the anterior part of the body and is coming out of the posterior part of the body. You could check my other series that I have done on the basic anatomy of the body where you talk about anterior. Anterior is the front, posterior is the back. So anterior posterior is the tube is passing through the anterior part, the front of the body, and the beam is going to be coming out of the back of the body. So that's what's called anterior posterior. You can see from how we define it as the beam enters anteriorly and exits posteriorly through the body. There is an image that depicts that. Next, we move on to another terminology we call posteroanterior. For posteroanterior, from what we already discussed about anterior posterior, what do you think? It is this time around your beam is coming from the back of the body and is exiting the front of the body. So another way I can explain this for you to understand is in this manner. That is, wherever the X-ray beam faces, right, is what starts the terminology. For instance, you can see from this picture that the X-ray beam is facing the back of the patient. And mind you, the X-ray beam is where the X-ray comes out from. And another way again you can put it is the part that is in contact with the detector would be the last word in that terminology, and that is your detector. What is facing your detector in this regards is the anterior part of the body, because the X-ray comes out from the anterior part of the body and collides with the detector to form your image. So you can sit down to rehearse that so that you won't forget. So here again, let's go back again. Posterior anterior. The beam is entering from the back. The tube that produces the beam is facing the back. So the beam is entering the back and is coming out from the front, right? And that's anterior. And the detector that picks the X-ray that is coming out of the anterior part of the body is the detector. So that's what sums it up as posterior anterior. And it is called abbreviated as what you call PA. PA view, AP view, PA view, AP view. I know you must understand what that is now. Then we move to lateral. For the lateral, you term that as the beam passes from one side of the body to the other side of the body, from side to side. So the patient just stands and the beam passes from either side of the body. Could be from the right to the left, from the left to the right, from the medial part of the body to the lateral part of the body. You can see my other video to understand medial, lateral, anterior, posterior, just normal basic anatomy. Having understood what lateral is, let's look at what you call your medial lateral. For your medial lateral, look at the two words. Medial means medial. Lateral means the lateral we've been talking about, the medial part of the body. Right. So now, in this regard, it says the beam traveled from the medial part of the body towards the lateral direction. So now, from your part of your body, you have your medial side, you have your lateral side. So this time around, the beam is starting from the medial side to the lateral side. So it's a part of lateral positioning. But this medial and lateral is in terms of the sides of the body. Now, look at the image we have here. You can see like an arrow pointing down to that part of the leg. Now, that part of the leg that the arrow is being pointed to is the medial part of the body. And you can see from there that the X-ray beam is passing from that side. And if it passes from that side, definitely where will it come out from? It will come out from the other side. So it will come out from the lateral. That what we define as mediolateral. This terminology is common for mammography. And let's now break that down for mammography. If you see the breast, right, the breast is always in this direction. It's always positioned like this. That is to say, the medial part, right, on the body is what is directly on the detector. So now the beam will be passing through that part, that's the nipple and co, to come out at the other side. So you just explained that the beam is passing through the medial part of the body and it's coming out at the lateral side. That's what that's explicitly saying. Next, we have what you call your lateral medial. From our medial lateral, we already discussed. What do you think that will mean? It means the beam is passing through the lateral part of the body and is coming out of the medial part of the body. And like I already explained again, you can use the previous one when I was talking about anterior, posterior, and posterior, anterior. What's the part that is closest to the cassette, where the beam will come out from and be inserted on the cassette? That's the medial part. What's the part closer to the tube where the beam will be entering through? That's the lateral part. So you could use that as well. So now the beam is coming from the lateral part of the leg and it is coming out of the medial part of the leg. So that's what we now term as lateral media. If I consider this position is lateral media of the foot. Now moving on, we're going to move on to what you call your oblique. Your oblique is the body part is rotated at an angle between your true AP or PA and the lateral position. When we talk about AP and PA, your body is just facing this. When you talk about lateral, they're talking about the side of your body. So now the angle between this time around, they don't want the body to be in true AP or P, and they don't want it to be also be in lateral. So it's always at the middle. So the positioning that makes the body part at the middle of these two position, either lateral or AP or P, is what you call your oblique. And at that time, your body is angulated and it could be in different degrees as far as they're not in complete 180 degrees or they're not in complete 90 degrees, right? In between all of these angles, right, is what makes up your oblique positioning. And you can have the different type of oblique, anterior posterior oblique, posterior anterior oblique, and different. But what anterior posterior oblique, posterior anterior oblique, we're going to talk about that in our next video. Now move on to your decubitus position. So when you talk about your decubitus position, it's saying the patient is lying down on their side, on their back or abdomen, while the central rays remains horizontal and parallel to the detector. Here, what this is trying to tell you is that it's either the patient is lying on their side, or the patient is lying down on their back, or the patient is lying there. It's just the position of the central ray. In decubitus position, the central ray is always horizontal and parallel to the detector. So imagine now for a patient lying down like this, you can see that the detector is at the front of the patient's abdomen and the x-ray tube is behind at horizontal pace. So with that, that's a simple term for a what you call a decubitus view. Then for your semi-recumbent positioning, Now, that's all for today. I remember I talked about semi-recumbent positioning. We're going to talk about that in our next video. Do well to like and subscribe to Learning Imaging Tech with us to get more understanding about radiography or medical imaging technology according to how it has been called in your home country. Thank you.